Hello everyone, my name is Boris Karaman. Thank you for tuning in to my presentation today. The distribution of health workers in relation to populations is an important factor that determines the health status of a given population group. Healthcare professionals' adequate staffing is critical to providing quality healthcare services and maintaining favorable patient outcomes. The following presentation will discuss the possible consequences of critical shortages of healthcare staff for patients and communities. Human resources for health primarily mean the availability of the human workforce in health facilities and in the professional practice of healthcare, Kangovy et al. 2020. Probably a shortage of human resources in the healthcare facilities may pose harm in terms of a high patient-to-staff ratio, a deficient healthcare system, and, consequently, the poor health of the individuals. When employing staff in healthcare facilities is low, the prepositions become overwhelmed with work, which results in providing little time for patients, offering less attention during consultations, and providing low-quality services since mistakes are most likely to occur. This can significantly detract from the quality of care as well as key procedures that should be implemented to effectively address patients' flow, aggravating health conditions as well as worsening patient outcomes. On the other hand, the adequacy of skilled health care workers can enhance timely access to care, efficient care coordination, and more importantly, make providers spend more time on their respective clients to improve their general health standards. From my personal experience as a registered nurse, I became aware of the effects of staff deficits in the healthcare sector. Insufficient numbers of staff in the healthcare delivery system pose serious consequences, which include frustrated and dissatisfied patients or clients, overworked and sleepy healthcare providers due to increased working hours, and undesirable health quality care results in the service populations, Ballard et al. 2020. These are dire outcomes that might not be far-fetched and are rather close to home for me and my organization, as our mission focuses on the enhancement of access and equal provision of quality health and healthcare for everyone in society. The experiences that I have had observing the pressure for an inadequate number of staff for both the hospital's employees and the patients have made me determined to achieve the goal of changing the healthcare system. It is an issue that calls for a strategic intervention, since the health and well-being of people and communities are defined by the performance and preparedness of the healthcare system and the stakeholders who serve it. The effects of a lack of sufficient staffing in the healthcare sector are reflected in several aspects of the clinical environment and present great obstacles to healthcare organizations and to the healthcare workforce that constitutes the foundation of the industry. This leads to reduced morale and undesired working conditions that may be considered more than reasonable in relation to the turnover of patients they handle, the risk of burnout, and overall job dissatisfaction. It is for these reasons that the various stressors can end up compromising the ability of providers to offer the kind of patient-centered, quality, and compassionate care that should be typical of healthcare facilities. Furthermore, the leaders of healthcare organizations bear the challenge of providing sufficient quality care and patient satisfaction while maintaining quality services, costs, and staffing that are insufficient in most cases. Stressed providers may ensure through consultations, delay or cancel appointments, or reduce the quality and depth of care that is being offered to patients, which leads to poor results and patient distrusts in the system. Strengthening the healthcare workforce is therefore a complex task that requires the provision of support to staff in terms of numbers, efficiency, effectiveness, and work environment that will enable the healthcare workers to effectively meet their task of improving the health status of the community. The first source of staffing shortage is the disparity in the healthcare workforce, as you can see on this slide. Higher healthcare needs of the population together with a decreased number of healthcare workers exacerbate the staff shortage. Others are low recruitment and retention of health workforce, little emphasis on healthcare education, and poorly motivated incentive programs for the healthcare professionals in the hard-to-fill areas. Ballard et al. 2020. Now, this slide is packed with data, and it is for a reason, because when it comes to the severe problem of shortage in healthcare workers, it is crucial to evaluate the possibilities and the globalization, delivery, and expenditure factors. Thus, it is possible to use numbers and empirical evidence to acquire important information to fulfill this analysis and advance strategic management. For instance, research has demonstrated that the costs of understaffing include the overtime pay that nurses are entitled to, the cost of recruiting temporary employees, and the costs that emanate from medical mistakes and needless negative occurrences. On the other hand, investments in the strengthening of healthcare manpower through better attraction, retention, and training policies have been proven to yield returns on investments such as better clients' outcomes, shorter hospital stays, and fewer readmissions. Other tangible downtime benefit, when complemented by the changing intangibles of patient satisfaction and staff motivation, make good business argument for presenting staffing deficiencies. However, integration of such solution entails getting it right, that is, planning and resource deployment. Efficient staffing and mix, the proper implementation of technology in practice, and supporting providers' mental and physical health are all crucial components of the solution. When bringing the analysis to the decision-making process to rationalistic terms, which involve relying on evidence and costs and benefits assessment, as demonstrated in this table, healthcare organizations can avoid the pitfalls of making fiscal decisions that ultimately threaten the ability to prove quality of care and stability of the healthcare system in the future, thereby making informed decisions that benefit both the organizations and the patients. Taking into consideration the fact that literature review from my previous two assessments demonstrated that understaffing of healthcare facilities is an ubiquitous problem, a comprehensive strategy aimed at the enhancement of the quality of qualified employees shall be implemented in order to address the problem. Introducing such an approach may pay off the organization and its colleagues, as well as the whole servant community. The available empirical literature entails strong evidence concerning the effectiveness of optimal staffing levels in influencing a number of vital themes that have to do with patient safety, increased patient satisfaction, morale, and job satisfaction among the healthcare workers, and thus improved healthcare outcomes. Thus, if the existing healthcare facilities are fully staffed with properly trained and motivated personnel, this contributes to the provision of high-quality, integrative care. It might therefore result in early referral to relevant services, a reduction in medical mistakes, enhancement of patient satisfaction, and in the long term, enhanced health of the target population. Also, well-staffed healthcare facilities promote workforce health and well-being and reduce workload pressure and burnout hazards affecting overworked providers. Hiring and developing competent, ethical, and motivated human resources for healthcare organizations is not just the right thing to do, it's the wise thing to do in today's increasingly competitive health economy. As such, efforts directly translate into enhanced organizational performance, sustainability, and clinical benefit within the respective populations. As healthcare institutions try to come up with solutions to tackle the extremely central problem of human shortage, this ought to be done efficiently, culturally, sensibly, ethically, and fairly. In this case, any steps that are being implemented to support support or increase the healthcare workforce have to be cautiously planned in the sense that one has to be very keen to not create additional outputs that can be disadvantageous to a particular group or community. Ethical risks like hiring employees for unfair wages, discrimination in hiring, or bias while deploying resources to develop certain areas should also be taken seriously. It is also important to consider the patient's need to prioritize culture and to incorporate as many diverse patient perspectives as possible for the prevention of regressing to cultural relativism and worsening the status of patients who are already marginalized. Alderwick et al. 2021. It is possible to conclude that the approach that involves equity in the context of solving the problem of workforce deficits will help healthcare organizations find approaches that will benefit all members of societies all over the world, regardless of barriers such as sex, race, ethnicity, and other factors. This may include direct outreach and incentive programs for the purpose of increasing healthcare professionals' diversity, culturally sensitive education and training programs, and funding distribution to areas with poor healthcare access. Overcrowding is also a result of a shortage of healthcare personnel in clinics, resulting in delayed patients' access to care, clinics' operation hours being affected as a result, and the high costs associated with delivering quality healthcare. Congavi et al. 2020. These problems are worst felt in deprived regions, where they compound all the associated problems of inadequacy, inefficiency, and affordability of health services. Combating the problem of staffing issue is a very important step towards attaining better healthcare results and eliminating disparities. Proper staffing of healthcare facilities have been found to have positive outcomes such as patient safety, satisfaction, and lower adverse effects. It can also increase staff motivation, reduce staff turnover rates, and increase job satisfaction, meaning that many organizations do not have to spend money on continually recruiting new employees. Moreover, decreasing the shortage of staffing personnel may increase the efficiency of the resources used and improve the solvency of healthcare organizations. And this concludes my presentation, and we now turn to the references slide. I would like to thank you all for your time and attention. Please let me know if you have any questions. I will gladly answer them, and thank you.